The Health Information Management Department at Oakland Regional Hospital supports all facilities in the health system: the hospital, the skilled nursing center, and the outpatient surgical and imaging centers in Warren. The HIM department is led by the director, Stephanie Tatum, who received her Bachelor of Science degree in Health Information Management in 2013 from Davenport University. Stephanie passed the exam to receive her Registered Health Information Administrator credential in 2014. As part of her director responsibilities, Stephanie also serves as the Electronic Health Record Administrator and HIPAA Privacy Officer for the health system. She oversees meaningful use reporting required by the federal government's HITECH Act, requiring hospitals and eligible providers to implement and use certified electronic health record systems. She is part of the team that monitors and then initiates training and process improvement to correct areas not compliant with the meaningful use measures. The HIM clerks perform the following functions on a daily basis: pick up all paper records from the floors. Despite going electronic, there is still a need for paper to be processed, but it has drastically decreased. The health system implemented the CPSI Electronic Health Record facility-wide in 2013. CPSI is rated number 1 for small hospitals under 100 beds. Once all of the discharge records have been reconciled, the processing can begin. This is almost the final step in the revenue cycle process. The revenue cycle begins when the patient registers for treatment. That is when all demographic information and insurance information is entered into the electronic system and is verified for accuracy. The second step of the revenue cycle is while the patient is being treated. All orders are entered into the system, and then all chargeable items are entered and tracked in the system and are accounted for as being used or the order being fulfilled. That includes all departments in the facility: physicians, nurses, lab, pharmacy, radiology, dietary, etc. The third step of the revenue cycle is when the HIM department reconciles and collects all documentation for discharged patients. Those forms are prepped and then scanned into the electronic system. The next step after the document has been scanned is to index each and every form. That means making sure the form is on the correct patient's chart, in the correct date of service, and located in the correct area of the electronic chart so that it can be easily found. The next step of the process done by the HIM staff is called assembly and analysis. Assembly and analysis in the old paper process meant making sure all documents were in the proper part of the chart and in the correct chronological order. In the electronic system, assembly and analysis means making sure that the provider entered all information in the correct section of the chart and on the correct date of service. The analysis portion is the part of the process where the HIM staff ensures that all patient records are completed in a timely manner and compliant with AOA standards. It is the HIM staff's responsibility to make sure that all documentation on the chart is present and compliant. Typically, these steps are completed within 1 to 2 days after the patient has been discharged. Once the chart has been completed by the HIM staff, it is then available for the coders to assign the appropriate diagnostic and treatment codes for billing. Coding is the process of assigning the correct codes based on the documentation provided. If something is not documented, then it did not happen. It is important for coders to have knowledge of anatomy and physiology and medical terminology so that they can decipher if additional documentation may be required. It is the ethical responsibility of the coder to only assign codes that match documentation. It may be considered a criminal act if a coder intentionally assigns inappropriate codes. The United States is the only country that uses these codes for reimbursement. If a coder intentionally upcodes a case to receive higher payment for the facility, that can be considered a criminal act. The Office of the Inspector General investigates cases of fraud to determine if they were intentional. The second part of the coder's job responsibility is called abstracting. That is the portion of the process where the coder verifies all patient treatments, outcomes, insurance, and other demographic information. The abstracted information is reported to the Centers for Medicare and Medicaid Services and other agencies as required by law, such as the CDC, to track certain diseases and illnesses. As mentioned earlier, the United States uses codes for reimbursement, but all countries use codes for data reporting and tracking. The fourth step of the revenue cycle occurs after the patient's chart or encounter has been coded. The chart then goes to billing, where the chart is then scrubbed by an individual or by a computer program to make sure that all information has been entered correctly, such as insurance numbers, date of birth, address, age, gender, etc. Once the chart has been scrubbed, the bill can be dropped. Most facilities are creating clinical documentation improvement or CDI departments to catch documentation errors prior to the patient being discharged. CDI departments are often filled with RHIT and RHIA credentialed staff who have coding experience. Referring back to the revenue cycle, the expected time to drop a bill is 2 to 4 days. If there is missing documentation or inaccurate documentation, the time can be extended while waiting for corrections. To reduce that time and to expedite receipt of payment from insurance companies, the CDI departments can catch and correct errors much faster. The electronic system allows the CDI staff to catch, notify, and correct documentation all in real time. It is now possible for the physician to be notified and make corrections without physically being in the hospital. One of the requirements of meaningful use is providing patients access to their medical records through portals. HIM professionals use their experience with HIPAA to monitor proper implementation and access information through the now widely used patient portal system.